hear myself echoing.
I hear that too.
I'm just going to go ahead and mute you, Ingrid. Okay. I think I'm good now. All right. So welcome, everybody. Thank you for meeting with us today. My name is Nicole Yee, and I'm joined with Milan here, who was the account exec on this group. So I'm the senior service representative, and today we're going to go over the emergency medical travel plan with you. If you do have questions throughout the presentation, you can either put it in the chat or raise your hand, and then you can unmute yourself and ask the question. Milan, can I ask you to just look over the chat just in case there are any questions?
Absolutely.
Perfect. So I'm just going to jump right in here. So first, let's talk about who Beneva is. So some of you guys may have seen SSQ. You might see AXA Assistance. So we're just going to go over a little bit of those details and history about who we are. So in July of 2020, La Capitale and SSQ, two separate insurance companies, joined together, and we became Beneva. So since joining, we've become the 4th largest group insurer in Canada, and we have also become a national company with offices across Canada from Vancouver all the way to Halifax with over 5,000 employees. So today we're going to cover the emergency medical travel. We'll do a high-level overview of your coverage, and then if you do have questions, it does say it at the end, but if you have questions along the way, you can always ask us and interrupt. All right? So let's first talk about who this plan is for. Here are the descriptions for eligible persons. So you can see there's the early retirees, and then there's the retirees as well. So those 4 different classes, you guys will fall under one of those. In terms of, I'm just going to check to see, I think somebody is, I'm sorry, Mary, I'm going to mute you. Okay, sorry, just gets rid of some of that.
Nicole, it's hard to tell if they're trying to ask a question or not. Like the sound is, yeah.
It might be better to use the chat function then. Are there any questions in the chat so far?
No.
Okay. So maybe it might be better that way, just because we are getting a lot of feedback when somebody unmutes themselves. Okay, so I'm just going to jump back to the presentation here. So we can see the benefits that they have. There's a medical reimbursement expense, which is $2 million per trip per person. So what that means is each trip that you go on, you get that $2 million per trip, and that's going to be for yourself, spouse, dependents. Each trip can last 180 days, and then so if you come back after 180 days, then you'll wait a day, and then the next day you can go ahead for another trip. There's emergency dental treatment for $2,000. Evacuation benefit is included in this plan. There's also a repatriation benefit for $15,000, family transportation and accommodation for $5,000, return of a vehicle for $500, rental expense for $200, hotel convalescence for $1,000, and then referral services outside of Canada for $500,000. There's no deductible on this plan, and there's 100% co-insurance, meaning that it's going to be completely paid for. Are there any questions about any of the benefits that we have here? Nope. All right, so now we'll just move on to some of the key highlights. So one of the things that I really wanted to emphasize is that it is $2 million a person per event. So like I mentioned before, that's per trip. Coverage is limited to 180 days with respect to any one trip. So you have a maximum that you can go for 180 days. Of course, it can be shorter than that too. All participating member spouses and dependent children must be covered under the federal or provincial health plan. And a dependent child can only be included on one of the member and family plans. So if you have, yourself and your spouse and you're both on there, then the dependent child can't be on both. It can only be on one plan. So the next thing that I want to talk about is just the exclusions and limitations. So there are some exclusions and limitations, and I would highly recommend taking, 5-10 minutes to look at the booklet just to get a full list of all of them. The one that I did want to highlight in particular is the stability clause for pre-existing conditions. So a pre-existing condition means that you've received medical treatment advice or consultation within 6 months of a trip. There's an exception for chronic conditions, which is considered stable. So it's considered stable by regular use of a prescription medication. A chronic condition is one that has existed for a minimum of 6 months, and stabilized means that there's been no change in the medical condition requiring any medical intervention, like the use of a new therapeutic drug for at least 6 months. Are there any questions about that? No. All right, so I will pass this one over to Milan just to talk about what to do in the while there is an emergency while traveling abroad.
Right. So thanks, Nicole. Again, in the event of an emergency, everyone at Dal has a travel card. If you don't have one, then it is available on the website. We do have the next slide. We do provide that information, the email address that you can contact. There's also on the university's website that you can obtain that, where, the booklet and the travel card are saved. And so it's important to have that because it really contains all the information that you will ever need. And so we always kind of recommend that you tuck your travel card in with your passport. That way, it's in a safe place, and that in the event that you do need it, it's with your passport. And so typically, we remember where we've kind of put that, tucked it in a safe and handy place. So again, in the event of an emergency while you're traveling abroad, it is really, really important that you contact AXA assistance as soon as you can. If you yourself cannot call AXA, somebody else can call on your behalf. Again, the numbers are on the back of your travel card. So the first thing AXA will ask you is, your policy number, which is on your card, and then your identification number, which is the same for everyone insured under this policy. In the past, the card is the exact same because as you've seen at the earlier at the opening of our presentation, is we used to be SSU, but even before SSU, we were AXA. And so I know that Dalhousie University has had the travel program with us for 10 years now. And so you've seen the different names over the years. However, AXA Assistance is very much still our emergency provider. And the way that it works is it is a self-administered benefit. So your human resources department, they are the ones that administer. So they keep track. They're the ones that have all the information of everyone that's insured that has coverage under the plan. We don't have that data on hand. The only time that an individual would be enrolled in our files in our systems is at the time of claim. And so the moment that AXA assistance is contacted, so what we call first call, they make sure that the individual is taken to the nearest hospital and is cared for. So that's done right from the moment that you call AXA, because as you can probably appreciate, calls can be made at different time, and we have our usual regular office hours, and let's say the accident occurred while we're not at work, for example. And so AXA assistance, once the first call is taken care of, meaning the individual is taken to the nearest hospital, let's say by ambulance, they would coordinate all that. Then they would communicate with us, our internal team, and we have key contact people at Dal University that we need to communicate with to obtain confirmation of eligibility. So we would send an email to Dalhousie University to those key contact people and to say, is Nicole, for example, covered under policy 1FF55, and then we just get confirmation. So from there, We then confirm to AXA Assistance that yes, the individual is indeed covered under the policy. Here are the various coverages that this member has, and AXA coordinates all that. And so it's really, really recommend. It's so much easier when AXA is involved, because especially when we're dealing with the United States, in the States, there are so many, there's an invoice for everything. If there's a nurse that actually, gave you prescription medication, there's an invoice for that. If a specialist saw you, there's an invoice for that. There's an invoice for the hospital room. And so it can get very kind of overwhelming as a member to just deal with all that. So the earliest that you can involve AXA Assistance, the better, because they coordinate all that. We also have agreements in place. AXA has agreements in place with various, medical facilities throughout the world, whereby there's agreements in place with respect to specific care levels of care. And so, for example, we have arrangements, so we'll say we're not going to pay more than $10 for an aspirin, for example. And so those arrangements are really key in making sure that we can keep your costs down as well, because your rates, the rates that you are currently paying for this travel product, again, it's a reflection of, those arrangements that we have, that AXA Assistance has with medical facilities. However, if, for example, if confirmation is received, because this policy is only for early retirees and retirees, there is a pre-ex or a stability clause under the policy. And so that, from the moment that we get confirmation of eligibility, AXA Assistance will request your medical file for the 6 months prior to you leaving your province of residence. And so they just need to make sure that the reason for your hospitalization, for example, is not as a result of a pre-ex condition that was diagnosed or whereby you've received care in the 6 months prior to you leaving your province of residence. Again, like Nicole mentioned, under the pre-ex exclusion, the definition that she's provided in the previous slide is exactly what appears in your booklet, in your contract, is that if it's a chronic condition and you've been diagnosed it many years ago, you are currently taking prescription medication just to keep that chronic condition stable, that is not viewed or interpreted as a pre-existing condition, and so it does not exclude you from being covered under the plan. However, if it's a new condition or even a change in prescription medication, if the dosage has increased, we want to make sure that you wait 6 months to make sure there's no adverse effect to that change. And so it's kind of a waiting period, if you want to, to put it in easier terms to understand how this pre-ex is applied. And so once it's deemed that no, the reason for the hospitalization is not as a result of a pre-existing condition, it is an unexpected illness, accident, then AXA would coordinate all those different bills, and we are the ones that actually pay the claims. And so we deal directly with those medical facilities. We will pay that. We have seen instances whereby, especially again in the US, they will, once the member returns home and suddenly starts getting invoices, bills from the hospital. And it creates a little bit of confusion in the sense that they're saying, my goodness, and they're saying, you must pay this within the next 30 days, or they put a lot of pressure. Again, it's really, really important to let AXA handle that and to not pay out of pocket, because again, of those agreements that we don't pay above a certain amount. And so when they get payment directly from an individual, oftentimes it's at a higher cost, and obviously the hospital will get more money if you do that, and it just creates a lot of back and forth. And so again, anytime that you have an unexpected illness, injury, it's really, really critical that you contact AXA Assistance as soon as you possibly can, and they'll look after you. However, that being said, if, for example, you're traveling abroad, you have a bit of a sore throat, we do suggest, that you get the proper care. You may go to a walk-in clinic or, whatever medical facility that you can access and get if you get a prescription medication, for example, and the rule of thumb that we use is $500 Canadian. If your claim is less than that, and it's not necessarily an emergency, we do ask that you pay for it out of pocket. Save all your receipts, and when you return home, you can submit those receipts for reimbursement. And so again, just for those little claims, those little off, we do suggest that you get the proper care and just save your receipts and submit them for reimbursement. If the cost is a little bit higher, or you simply don't have the means, or even sometimes it could be a language barrier where you're not, you're traveling in a country where maybe Spanish is predominantly, the spoken language, it can be overwhelming. So by all means, Access Assistance is there for that as well. They are present across the world, and they can provide assistance when it comes to that. So they're kind of like your 911. Anytime you're leaving your province of residence, anytime you leave Canada, AXA is your 911 for worldwide travel. So I'll pass it over to Nicole.
That was perfect. Thank you, Milan. So the card that Milan was talking about is actually this card. So do you guys have access to this? It doesn't have your name on it, but as she mentioned, there's the identification number and then there's the policy number. So this would be the number that you would use in the event of an emergency. And, you have access to this. Make sure that you take it with you whenever you go out of province, and you'll always have that there with you. There's
Just one
also
sec, Nicole. Sorry,
yeah.
I just there's some questions here, and I just want to make sure that we
Sure.
address them before we move further. So, okay, so there's a few. So, there's one that it's okay. So what I will do, because these questions are very specific and they're rather lengthy, what we will do is Nicole and I will answer them via email, if that's okay, and then that way you'll have a more kind of a better answer, because I see they're rather specific and long, and so I apologize. What we'll do is we'll take your questions and we'll answer them under a separate one. The other thing that I do want to note is historically the travel card. Again, don't be alarmed. Nothing has changed. The numbers are still the same. The contact and all that. We do have a toll-free number for our claims department. That's only in the event that you've submitted a claim for reimbursement and you wanted to know the status, or you have some questions. You can certainly call that number. The other thing that I do want to note is the identification number. In the past, it was 427E. The E was just to identify Eastern. But now with Beneva, everything is, all our claims are all handled out of our Montreal office. In the past, they were scattered throughout, throughout Canada, but now it's strictly, all travel claims are adjudicated in our Montreal office. And so we don't need to identify which region. So E was for Eastern region. We had W for Western region, C for Central. And so don't be alarmed, that identification number is still the same. It's just a letter, we've dropped it.
Perfect. So I do also want to mention about this. This can also be found on your portal. So this card along with this FAQ here. So these are just some frequently asked questions. You can take a look at that and see, if any of that applies to you. So, there's questions like, what happens if I contract COVID? Basically, it's not an exclusion under your plan, but you can take a closer look at that later if you'd like. The next thing that I want to mention is that you guys have some resources available to you. So the one that we keep bringing up is that portal that you have. So you can go to that link and all of your travel information is going to be under the heading travel information. And if you do have any questions beyond that, you can always reach out to your HR team at benefits@dal.ca, or you can give them a call just for, general inquiries or to confirm coverage. And then lastly, just to remind you again, AXA is only to be called in the event of a medical emergency while you're traveling. Other than that, if you have questions, and you can reach out to your HR team. So that brings us to the end of the presentation. I don't know if we have any more questions at all.
Well, there's a couple there noted in there. Just to come back to the to AXA, only calling them in the event of an emergency. They do provide assistance. So one thing that is not covered under your plan is trip cancellation or trip interruption. However, if, for example, you lose your luggage, which we've heard a lot of individuals losing their luggage, it's been an issue. AXA can provide assistance in trying to locate your luggage. However, again, trip cancellation, trip interruption is not part of your travel program with us. It's something that can be purchased as a standalone. Most credit card companies do offer it. When you're booking your flight, they'll ask you if you want that included. Again, it is entirely up to you if you want to add that, but it's not something that is part of this program. Another thing that I do want to note is AXA does provide other services other than just, in the event of an emergency. Is if you're traveling in a country, you want to know a bit more about, the environment. Are there any vaccinations that I should be made aware of? Any things like that. AXA can also provide assistance with that. They can tell you, okay, if you're traveling in such and such countries, here are the vaccinations that are, recommended that you have prior to leaving. So they're a good resource to have. And all that, the different resources that they offer is on the back of your booklet. And so it lists all the different services that they offer in addition to being your emergency provider in the event of emergency while traveling abroad.
Perfect. And I do see there's a couple more questions. Is there an age limit for coverage? And so, oh, go ahead.
Oh, there's a hand up.
It's my hand up. I just have a question. I see quite a few questions in the chat that relate to pre-existing conditions. And I suspect that that's the major thing that's of concern for most people, because although there's some things written down, an awful lot of it depends upon someone's interpretation. So maybe if I could get some better understanding, and I will use asthma as an example, that someone has asthma and their medication has changed. They haven't been in hospital, but their medication changes. Now they get an exacerbation while they're away. And what happens with that? Someone can relate it to the pre-existing condition, or it could be new because they've never been in hospital before with it.
Correct. So the simplest way to explain how the pre-ex is applied is really what is noted in your medical file. And so AXA assistants would request that. And then, our team of, they have medical doctors and all that, they would review it. They would also review it with the staff in the hospital. Let's say that you're in the US and you're hospitalized there. And so they would review it. Your medical file is requested, and they would review. And in some cases, the reason for you being hospitalized in the US has nothing to do with the medical condition, that you have. And so that's how they decide if the claim is admissible under the policy, and if the reason for being hospitalized, again, for lack of a better example, is related or not to pre-existing. So again, it's really what's noted in your medical file and what they would view as a change.
So if someone had, and another example might be, someone's had a coronary angiogram and they can show obstruction in one of the vessels. Not enough to do anything about it on there, but then someone has a heart attack. Is that obstruction of the coronary vessels that has had no treatment considered a pre-existing condition?
It would be, because your file would be noted, and it does say within the definition that if you've consulted, if you've received medical tests, even if your tests all come back that they're all good, but again, when you're talking about the heart, that can be quite convoluted, for lack of a better word, and we just have to be very, very careful, because anytime that you're receiving care or that exam or whatnot, have to make sure that you're considered stable before you travel.
And stable is that 6 months?
Exactly. Yeah. I always kind of explain the 6 months as a waiting period. So from the moment that you've seen your attending physician, whatever tests you've received or a change of prescription medication, wait 6 months from that date onwards, and then you've met that pre-ex waiting period, that clause of 6 months.
Thank you.
Oh, you're welcome. Are there any other questions or?
Hi, it's Lynn Johnston. I have my hand up if I could ask a question.
Sure.
So I just want to reaffirm what I think I heard. If the event that requires care while you're traveling has really nothing to do with your pre-existing illness, is that likely to be eligible for coverage?
Yes.
Yeah, I mean, again, once your medical file is reviewed, and it's deemed that it has absolutely no, like one of the simplest examples that I can provide you is, we've had this happen countless times, as an individual is in the US, for example, and has a fall and breaks a leg or a hip. It obviously needs to be hospitalized and potentially surgery, depending on how severe. Because oftentimes, as you can probably appreciate, if surgery is required, then AXA and the medical providers in the hospitals would look at can the individual be brought back home to get surgery, or it must be done, in the US. So all those are kind of looked into. So obviously, the fall would most likely not be related to a pre-ex. And so again, once your medical file is reviewed and deemed that no, the fall and the reason for the surgery, the broken leg or broken hip has nothing to do with a condition, then it would be covered as per the terms and conditions of your policy.
Okay, that's helpful. Thanks. Because I think you can appreciate that most of us, once they reach a certain age, have conditions that are really pretty stable, but might have minor modifications made in treatment. So we could make travel plans, and then, a week later, as the other gentleman said, either some exacerbation intercurrent of their asthma or some other really minor condition requires a change of medications, usually which we've had before. We could spend our life waiting forever before we would take any travel. So that's helpful, I think.
Yeah,
Thank you.
no, and it's certainly not. I mean, I appreciate your comment, and it's certainly not the first time that I hear this comment. But again, I think the key is just to make sure that, and we always recommend that you have a conversation with your attending physician to say, not that your attending physician can write a note and then it removes the exclusion from your contract. However, it is good to say, what is the likelihood that I could have something happen while I'm traveling abroad and have to be hospitalized because of this, minor change in prescription and so, yeah, having the conversation and having that kind of peace of mind. But the 6 months is definitely there to make sure that you're stable and well enough to travel. I see another hand up, but I don't see. Do you see who it is, Nicole?
Let me
I hope it's
see.
me, Robin White.
Yes, Robin.
Right. At the outbreak of COVID, I knew very well that I wasn't going to be traveling for a very long time. And I wondered then whether there are opportunities to opt out. When I made inquiries, it sounds as if it's linked to all our benefits, and there is no possibility of opting out or opting in again. What's the situation?
You mean for opting out of your travel program?
Yeah, say I wanted to, say I didn't like the package. Say I wanted to stop travel insurance because I wasn't going to travel for 3 years.
So you will need to communicate, you'll need to have a conversation with your benefits department. They would be the ones that would tell you if, you know, what's available and if you're able to.
I can chime in on that. It's just Marcy Nixon from the benefits department. So I think what you're referring to is our health and medical plan goes together. So you
Right.
can stop them at any time, but if you wanted to opt out of travel, you would also be opting out of health. So our health and travel always goes together. So you could opt out, but your medical would also be canceled. And as a retiree, it is a closed plan. So unfortunately, there's not a future option to, you know, to opt back in the future. It would be kind of a final decision.
Right, that's what I thought.
Yeah, that is right.
Thanks, Marcy.
No problem.
So just a little bit of information. Nicole, I think we see your
Oh.
email there on the
Oh my
presentation.
goodness.
Um,
Sorry, I tried to swipe it away and it must have just popped up. Sorry about that.
So the other thing that I just want to provide comment on, you know, the rates that you currently have for your travel program for a group of early retirees and retirees, I can assure you that they're quite competitive, because I do know another university had conducted their own market study a few years ago just for retirees, and they were not able to obtain rates that were nearly as competitive as what ISI has. So it's not just specific to Dalhousie University, but because you are part of a much larger group of other universities, which are all under the ISI umbrella, you do benefit from competitive rates for a rather comprehensive plan. Yes, the pre-ex is still a big one, and I do understand and appreciate that it can be, you know, it can be challenging for some. However, your plan is quite comprehensive and has, you know, has been quite good for a lot of our retirees who travel abroad, because having 180 days trip limitation, that equates to 6 months. And so on an individual plan, it would be very, very costly to get something remotely comparable to what you currently have. So
I just want to
I-
double check to see if
yeah,
there's
I still
any other
see
questions. I
there
see there's a
are.
couple hands up. Faye, do you have Faye Woodman? Do you have a question?
Yes, thank you very much. I have had a trip booked to England for December for quite a time. And a couple months ago, just by accident, my doctor found a symptomless chronic condition for which I have to take AFib medication. Normally, even medication is not prescribed because my level on a certain chart, but I'm old enough that prophylactically they've given me some medication. Okay, so it's pretty clear that even though I haven't had this condition for 6 months, so I can't be stable for 6 months. And I was wondering, does Benevieve or do you provide? Sometimes you can get extra insurance, top-up insurance to cover someone in my pickle who wants to go and just accidentally discovered this without symptoms condition. It's a curious situation to be in.
Yeah, for sure. So as part of your group program, we don't offer top up. What you will have to do is obtain individual travel insurance. and, specifically for that medical condition. So you will be, medically underwritten based on your own overall health. And so that's individual travel insurance. And we unfortunately don't offer that at Beneva. However, lots of other carriers, Blue Cross is one of them, where they still have a individual travel product that could be a good fit for you. But there are various ones out there that you could certainly explore and see what could be done.
Thank you.
You're welcome. The second hand up is Elaine.
Sorry.
Is this
Yes.
if you had a condition,
I
and it's 12
wanted
to 16,
to find
then you
out.
go down there, you had some problem because of that condition.
I think there's somebody else talking as well.
Okay,
I didn't. I don't know what's going on, but every time
I just saw that they were talking, so I just went ahead and muted them. You can go
Okay.
ahead. Sorry about that.
Perfect. Thank you. Two questions. One, I had put in the chat and I didn't see that it was answered yet. Maybe it was, and I just missed it. But when will the recording be posted, and will the slides be posted?
So we
To
will
the-
provide Marcy with both. Well, she has the recording, so that's being recorded on her end, but we'll also provide her with the presentation after our session today.
Okay.
And then I'm not entirely sure what the process is for uploading that to your DAL portal, so I can leave that with Marcy to determine.
I'm traveling on Sunday, so
Okay, so it's Marcy speaking now. So yeah, we definitely will, get this on the website, and I will be providing it also to Peter Wallace at the ADRP, and I think he'll be posting it on the Association of Dalhousie Retirees and Pensioner site. I will say I am in a conference the rest of this week, so it won't be posted by this weekend. But certainly, if you have any specific questions about travel coverage prior to your trip on Sunday, then definitely reach out to the benefits office, at benefits@dal.ca, or you can give us a call at 902-494-1122, and we can definitely answer your questions prior to your travel.
Perfect. One more thing I wanted to ask about. You mentioned COVID earlier, and could you talk a little bit more about if we do get COVID while we're gone? Is the procedure in terms of dealing with the travel insurance, getting care, the same as anything else, or are there specific things,
So there's no exclusion for that. So if you were to get COVID on your trip, most people don't require medical attention when they have it more recently. But if in the event you did and you were hospitalized, it would be the same procedure as we've talked about, or that Milan talked about earlier, where you would call AXA, if you're in the hospital. If you were unable to, then somebody that you're with can call them, and then they would coordinate the payments that way.
Okay. I don't know what the situation is right now, but if you are somewhere and you've tested positive and the airline won't let you come back, is until you're, not contagious. Is there, it seems like that there's something to cover when trips have to be extended because of illness.
So I don't believe that would be covered. That would be more like a trip cancellation. So that one wouldn't be covered. It would be at your expense.
I see. Okay.
Yeah. But if, for example, if you're hospitalized and for, 3-4 consecutive days and you missed your return flight home because you were hospitalized, that is a different scenario. So if you're hospitalized and again, you miss your flight, AXA Assistance, they would reschedule those flights at a time where you're able to leave, to return to your province of residence. But if you missed your flight because you know, for other reasons, or that you're unable to take the original flight that you were intended to be on because you have a COVID diagnosis, then yeah, that is a separate issue, and that would fall under your trip cancellation or trip interruption if you've purchased it.
Okay. Sorry, one more thing. We're going to the States. We're also Canadian citizens and Americans. So we have hospitalization on Medicare. So it would, in that case, Medicare be considered primary and the travel secondary?
Correct.
Okay. Okay. All right. Thank you.
Oh, you're welcome.
There's another question here. Let me see.
Peter.
Peter Wallace.
Peter
Yeah,
Wallace,
this is, it's just quickly, you never answered. Somebody back there asked, is there any age exclusions, and what is your take on that?
I'll have to pull the file. I do believe it was age 65 where it terminates, but I have to look at the file and confirm that in writing. But I do believe it's age 65.
No, that's for early retirement, but what about a regular retiree? Is there any age exclusion for travel?
You mean when the plan terminates?
No, when just for the whole plan. Is this covered until we expire?
I'll have to confirm that in writing. I'll have to go back into because there's a lot of endorsements over the years, and one of them was the eligibility that was amended several years ago, and so I'll have to circle back and confirm that with you.
Yeah, because like Johnson, I think, has their travel insurance doesn't cover you if you're over 84, I believe, or 85. This one will cover us forever.
We've seen different
I think
things.
I think you're misinterpreting me here. Like travel insurance, it should be, well, we have extended health benefits and the travel insurance plan, and we pay into it now. But I'm just, so this plan should theoretically go when? How long? How old should we be before we no longer cover it? Can I travel when I'm 98? That's the question.
Yeah.
Yeah,
Again,
we don't have a termination age on ours, so I could answer that.
Yeah, and I think that has to be made clear. Yeah, okay. It was just a misinterpretation there.
So as long as you're covered under the health, Marcy, as long as they have the health, they have the travel?
Well, they have the travel, and our travel policy doesn't have like an age of termination. So technically they could continue their coverage, until 99. But yeah, there's not a termination age in our coverage. So
okay.
And Robin, I see you have your hand up.
Yeah, I wanted to loop back on Doug McMillan's question about the person with chronic heart disease who sees his doctor. His doctor does not opt to put him on bypass, but give him a coronary artery surgery, and he goes on vacation. And you're saying that if he then requires coronary artery surgery when he's away, that was a pre-existing condition. But as I understand it, maybe I didn't understand the question correctly, the doctor would not send him out of the clinic unless he thought he was stable. So by definition, somebody who's been to see a doctor for chronic heart disease and treatment is not being offered is surely by definition stable. But
you're saying that they require surgery?
Yeah, and then they go abroad and unexpectedly.
Oh, unexpectedly.
Your interpretation of that was that was a pre-existing condition that by definition was unstable because it required surgery. But I don't think that's the intent. I hope that's not the intent of the policy, because I would guess that when that guy went on vacation, his cardiologist would be perceiving him as having a stable condition. Otherwise, he would be planning coronary artery bypass.
Was that the question about a member being put on Lipitor for cholesterol and then they end up having a cardiac event later?
No, nobody mentioned drugs.
Okay.
It was just somebody has chronic ischemic heart disease. He's not booked for any further treatment. He goes abroad. He requires further treatment. Well, I would have thought when he left the doctor's office prior to traveling, his physician would perceive him to be in a stable condition. If it were otherwise, he wouldn't have gone traveling. You follow me? You're making a retrospective judgment based on what happened rather than the condition when he left the country. Do you follow me?
It all, yeah, no, I do. It all depends what's noted in your medical file. Really, I mean, I'm not a doctor by any means, but it would be, it would be something that would be discussed with the attending physician in the, in the country that you're traveling to, or that wherever you end up being hospitalized, and to determine, yeah, they would look at your medical file and see what was noted. And so if there's nothing noted, there was absolutely nothing to indicate that you could have complications or suddenly not be stable if you travel abroad, then yeah, I again, it's all related to that specific incident, and if it is tied in any way, shape, or form to that, to what is noted in your medical file. And again, we can only go as far back as 6 months prior to you traveling. So anything, that's older than the 6 months preceding your trip, that would not be, it would not be, no, it's not relevant, exactly.
Mm-hmm. There was another question that was sort of in relation to that, but the question was, if people don't have a family physician, what happens if they can't access a medical record?
And that's a reality of a lot of individuals. So again, if there's absolutely nothing, then you would not be aware of a medical condition. And so there's no, there's no means, there's no way for us to tie it to potentially tie it to a pre-existing condition. And so most likely you would be covered under the policy as per the terms and conditions of the policy.
Okay, so I answered that incorrectly in the chat, so please use Milan's response to that. Let me see. There's another question. I'm trying to get a sense of how often people find coverage is denied for pre-existing conditions. Can you provide any information to help clarify this risk?
Yeah, we don't have a lot of data, and it really doesn't. It doesn't happen that frequently, to be honest, because we have regular meetings with access assistants, and especially for large files, we get a lot of feedback and we get a lot of statistics and all that. And there's not a lot of them that are really denied as a result of a pre-existing condition. Anything specific to Dalhousie University, I would not be able to obtain. But overall, as our block of business, it's not. Typically, those that do have that pre-ex clause, they are very familiar with it, or they obtain kind of top up or individual insurance, whereby it could, they could potentially get a shorter pre-ex exclusion. And so that's why we probably don't see a lot of them, because those, especially snowbirds, where they spend, long periods of time abroad, typically they'll secure additional travel insurance. And so this one would not be, the plan that you have with Dalhousie University may not be their primary one, especially when having a medical condition that was that could potentially be a pre-existing condition. And so what we see is those folks typically would purchase individual travel insurance.
And there's a hand up from Lynn Johnston.
Yeah, thanks. You've answered some helpful questions about specific circumstances. I had more or less assumed, but maybe I'm wrong, that before we travel, if we did have some questions about whether what's going on with our health would meet the pre-existing exclusions, that we could actually have a chat with someone just to get their sense of it. Is that correct? And if
Well,
so,
I mean,
who?
yeah. everybody's driving a pen. No, well, I mean, you know, typically the first point of contact is your human resources department. And then if they cannot answer, you know, your question with certainty, then they send it to us. They send it to Nicole, who's the service rep on your group. And so really your first point of contact is your HR department. And typically the questions that we get, they're very, very specific, whereby we escalate it to either AXA or to our claims department to respond. So if you're ever in doubt or anything like that, you know, you want to have some kind of reassurance or certainty that your travel program will cover you for, you know, while you're traveling abroad, then by all means, yeah, you can reach out to your HR department, and then they in return reach out to us for an answer. Most of the time, your benefits department have been able to respond to the majority of them, the general questions. But again, if it's something very, very specific, by all means, they know to contact us.
Yes, and sorry, it's Marcy again from benefits. I'd just like to state too, you know, we're able to help with most general questions, but if you do have specific information that you're sharing that's private medical information, like we would not ask you to share that with us. I just want to make that clear, like we're not asking you to send, you know, us in the benefits department all of your personal medical information. So if you had a situation like that, definitely as the first point of contact, reach out to us, but then we'll put you in touch with the right person who can answer it on their end. So I just don't want anyone here to feel uncomfortable that they have to, you know, disclose all their medical history to the HR office because, you know, we'd like you to keep that private. So.
Yeah, no, good point, Marcy. Because it's the same on our end as well. I mean, there's no, you know, the medical underwriting is only done at the time of claim. And so we can't, you know, without the medical file, sometimes we're not able to really respond with certainty that, yes, your travel program will cover you while you're traveling. Again, it really requires, you know, an attending physician to review, or a specialist, whatever the case may be, to review that medical file, and you know, somebody who's knowledgeable and is aware and familiar and can say with certainty if, you know, if the hospitalization is as a result of a pre-existing condition.
Let me see if there's any other questions in the chat. Any other questions at all? I think everybody is satisfied then. Well, thank you for joining today. And if you do have any questions, please reach out to, you know, your benefits team. We will get back to Marcy with all of those, you know, some of those other types of questions that we had in there, and, you know, provide confirmation on that. And we'll also send over the slideshow. And then whenever she's ready, she'll be able to post that onto your portal.
Great. Thank you.
Thanks, everyone. Take care.
Thank you very much.
Bye.
Bye.